Hello and welcome to this AC Education presentation on supporting children and adolescents who've experienced bereavement and loss in relation to coronavirus. My name is Christina Enright. I'm a child and family psychotherapist specialising in trauma and attachment and also a freelance trainer. Before I start the presentation, I just want to acknowledge that this is a very anxiety-provoking time for all of us, and for anybody who's watching who's experienced a bereavement, either in relation to coronavirus or for another reason, then I would like to send my sincere compassion. Okay, so just to run through what I'm going to be talking about in the next 20 minutes or so. So we all know that an inability to mourn can really hamper the grieving process, and children are not particularly well equipped with the sophisticated emotions that are needed to be able to work through experiences of grief on their own. So it's very important that they have the support of adults around them in order to support their emotional well-being and mental health. And talking to children about how a loved one is very sick or dying or has died is never easy. And I'll talk you through how you might do that in a way that's helpful for the child. And also ways of explaining to children why they're unable to attend funerals at the moment. And ways of helping children to grieve, even if they're not able to see that person to say goodbye or to attend the funeral. There are many meaningful ways that they can say goodbye and work through their grief that you can help them with. And whether you're a parent or a foster carer or anyone working with children in any capacity, you may know that child best. So these are just some ideas that might be of help to you at this moment in time. So just like adults, children experience a myriad of emotions in relation to bereavement and loss. Emotions such as fear, anxiety, confusion, sadness and grief, frustration and anger. And there are a number of theories around designed to explain the human experience of grief and mourning. And one particular theory is known as the stage theory, which dictates that human beings move through the stages, experiencing a range of emotions and reactions. So, for example, anger, denial, bargaining, coming to the last stage of acceptance where they're able to come to terms with the loss of that person who's died. However, more contemporary theories think about it in terms of being able to somehow continue the relationship with that person, to hold on to that relationship or bond that we would have had with the loved one, and being able to somehow relocate that person in our psyche and in our memory systems. And so it's rather than getting over the person, it's about holding on to the relationship while still being able to accept that that person is no longer with us. So the grieving process is unique to each person, and so there's no right or wrong way of grieving. And when it comes to children, what's important is that the child is able to express their full range of emotions and to have them accepted, and to have the availability of adults who are compassionate, accepting and supporting of those emotions. So we know that children of different ages and stages respond differently to loss. For example, much younger children haven't got the cognitive capacity, developed cognition to be able to understand that when a person has died, that they're not coming back, that they're actually gone forever. And as a child gets older and their cognition develops, they become more able to grasp the concept of death and to understand death as final. Younger children, the way they process information means that they hold certain beliefs about the world and about themselves, and they can believe that something that they think or they wish for or they say might actually make it happen in the outside world. We call this magical thinking. And this is very relevant in relation to coronavirus because, for example, a child might believe that they caused somebody close to them to get sick or to die because they didn't wash their hands properly. So you can imagine the burden of responsibility that that child can carry in relation to something that wasn't their fault. So I also want to talk about unique experiences of children in the care system when it comes to grief and loss. And we know that these children have often experienced developmental trauma, and so they may not have the cognitive and emotional maturity expected for their chronological age in order for them to be able to understand the finality of the loss. So it's about really observing these children and young people and just to notice how they're making sense of what's happened and if they're able to really fully grasp the reality of the loss. These children may struggle to feel, acknowledge, and understand their own feelings. Their feelings might be too frightening for them to allow in, so they may try or suppress or deny them. Or they may only be able to feel the more powerful feelings of anger, because the more vulnerable feelings of sadness and despair may be too difficult for them to bear. And current losses may be compounded by the previous experiences of trauma they've had. So re-triggering these previous unresolved separations and losses for them, making it all the more difficult to manage. They may express their feelings of distress and anger through their behavior because they don't have any other way of knowing how to communicate it. And they often struggle to regulate their feelings, which makes it even more difficult for them to be able to deal with the added stresses that they may be experiencing in relation to a bereavement or a loss. And so what's important for these young people is that they have adults around them who understand this and are patient and who understand that behavior can be communication. It can be communicating that the child or the young person is unable to hold the overwhelming emotions that they're experiencing and that they need help with them from the adults around them. So in my experience, adults are often anxious about sharing difficult or information or bad news with children. They can be trying to protect the child because they're maybe fearful that if they tell them the truth, that it might be too hurtful or too difficult for the child to bear, or they might be afraid that they'll overwhelm the child with information. And sometimes adults themselves can feel quite fragile because they are trying to deal with the bereavement themselves, and so it can be difficult for them to hold the child's emotions while managing their own. So what's important to know is that children are more resilient than we give them credit for. And children can bear anything if we tell them the truth and we allow them to share the feelings that they have about that and we support them with those feelings. It's much easier for children to be able to navigate their way through some of these difficult experiences if they have adults around who help them to make sense of them and understand them. And if an adult isn't able to support a child because they don't feel strong enough themselves, then it's really important that there's another adult, substitute adult available to help that child with their feelings. So when it comes to sharing information with children about somebody close to them who's become ill, of course, it's always difficult to break bad news and it can be difficult to receive it. But it's very important that we, where children are concerned, that we're open and honest with them. Children need to be informed truthfully about what's happening. And if information is withheld from children, we know what they do is they, in their imagination, they fill in the gaps of information that they don't know about. And that can mean that the child blows everything out of proportion or can create catastrophes in their own minds. So it's very important that we're making sure that all their questions are answered and that we give them as much information as we can about what's happening, using age-appropriate language. And of course, we would speak to a younger child in a very different way that we would speak to a teenager who would be able to make much more sense of what's happening and would need much more information. So as much information as you think the child can manage in one sitting, particularly younger children. And if the person that the child is close to the child is ill, either in hospital or in another place, consider if it's possible for the child to be able to communicate with that person by, for example, writing a card or a letter, sending a text, creating a video message for them, or if the situation allows, to be able to speak to them directly on WhatsApp or FaceTime. And this would be incredibly comforting for the child to be able to do that. So we know that it's important that children have as much information as possible about what's happening, and to share that information without being fearful of how the child is going to react. So as I said earlier on, children can deal with a lot more than we give them credit for if we're there to help them with feelings and the questions they might have as a result. So it's important to prepare the child for what's to come. So you might say, in the case of somebody who close to a child who's ill, you might start by saying, you know, that we talked about this virus the doctors call coronavirus or COVID-19. And you might give the child some space to respond, because very often in those spaces we can learn a lot about what's going on in the child's mind. And then you could say, well, this morning we heard from the hospital that grandma went into accident and emergency yesterday, and the doctors think that she has the virus. Now, the child might stay silent, or they might ask, is she going to be okay? Or even, is she going to die? It's important not to give children false reassurances about difficult situations. We don't know what's going to happen, and so therefore we don't want to give them misinformation. So you might say, well, we don't know what will happen, but we do know that the doctors and nurses are doing their best to take good care of grandma. They're giving her oxygen to help her with her breathing, because the virus affects people's lungs, making it difficult for them to breathe. If anything changes with grandma, I will let you know. And this is very reassuring for children, because then they can trust that the adults will tell them if anything changes. So don't be afraid to say that you don't know what's going to happen. The ambiguity is incredibly difficult for all of us, but we can help children to deal with that by being open and honest in our communication with them. And so when somebody close to a child has died, again, this is really difficult for adults to have to break that news. You know, we feel so powerfully about children's emotions, and we want to protect them from them. So we might be very careful about how we share that information. But again, it's important to prepare the child for what's to come. And you might say, I have some sad news about Grandad. Be open and honest with the child, and try to avoid euphemisms like Grandad passed away, Grandad went to sleep. For children to be able to understand the reality of what's happened, it's important that we use words such as dead or died in order for them to really grasp that that person is not coming back. And also using euphemisms like Grandad went to sleep can make it very scary for children, for themselves to go to sleep, or for other people they love to go to sleep, because they might believe that they will die, or somebody else will die if they go to sleep. So you might say, remember I told you that Grandad has coronavirus? Well, he got very sick. The doctors did their best to make him better, but last night Grandad's heart stopped working and he died. And that's really explained very clearly to the child what happened in a child-centered way that they may be able to understand. So acknowledge that you've given them this sad news, and they may be having many different and many difficult feelings right now about what you've just told them, and they might need some time for it to sink in, for them to be able to digest that information. It sometimes helps children if we imagine out loud how they might be feeling. So perhaps you might say, I wonder if that feels like a big shock to hear about Grandad. I know, I was very shocked when I heard about it. Or that might feel very confusing to hear that Grandad has died, because only 2 days ago we were talking to him on FaceTime and he was laughing and joking and we were having a lovely time together. And then once the child has received the news, it's important to check in how they are doing and what they might need from you. Usually children need a lot of support and comfort after a difficult news of bereavement. And so being available for them to ask questions or to talk, or even just for close physical contact, for hugs and cuddles, just so they feel safe and they're reassured that although this person who was close to them died, there are other people around who are still they're going to be there available to look after them. And we know everybody is different, just like adults, children are different in terms of how they respond to these situations. The child might go into shock of when they hear this information and shut down, where they're not able to think, feel, or speak in the moment. Other children might ask lots of questions and want to talk about it for some time. And others may want to stop the conversation fairly quickly and go and play. And that's quite normal thing for children to do. And even for us as adults, when we hear the news of a loved one dying, the way our brains try to deal with that information is to move in and out of the reality of what we've heard. So adults might move from being incredibly sad and upset to doing something practical around the house, just as children might feel very sad in the moment and then go and play. And again, what's most important is letting the child know that you're available to them to share what's on their minds and for them to ask whatever questions that they have, or to get what they need. Might they need a cuddle? How could you help them to feel safe and secure? And the children, once they know that we're available, they will seek out the support that they need.